Magandang umaga sa inyong lahat, mga Kulasa, fellow Kulasa. This is Therese Zapanta-Verzosa. What an honor to be speaking to you today. I am speaking to you from Bonnet Lake, Washington, my residence. I am also speaking as a registered nurse. In the Philippines, as soon as you enroll for nursing, it is a 4-year degree. After you graduate, you will earn the title BSN, Bachelor of Science in Nursing. After you take the board exams, you will earn the professional license, and now you are called registered nurse or RN. In my case, I am a BSN RN. Our nursing counterparts in the States, not all of them have a 4-year degree. Some of them, they only took 2-year degree or associate's degree, they call it, and then they take the board exams in America, they pass it, they become an RN, and then now they are ready to work as an RN. If we find ourselves Filipino nurses working in America one day, we have an advantage because of our 4-year degree. Usually, BSN degree holders have an advantage of holding managerial positions. If you are someone who likes to work in the administration, in the hospital setting, or clinical healthcare field, then BSN degree is a plus. You don't have to be good at math. Math is not my favorite subject. And so in nursing, the most difficult subject that I encountered is biochemistry. It was given to us during the first year. So math isn't something that you need to be worried about. Mostly about nursing is science. That's why it's called Bachelor of Science. You will learn how the human body works. The most interesting and the most encouraging part of taking up nursing is that it is so easy now to see how the human body works because you can see it in videos. You can see it on YouTube. Back in the days, it was difficult for us because we didn't have the access of internet. But this time, nursing is so much fun. You can see how the workings of the human body is, and it's really interesting and very illuminating. So nursing is going to be a fun course for you if you are interested in taking care of patients. Well, your patients are going to be very sick, meaning when you are sick, you are not kind sometimes, you are not friendly sometimes. You will be irritable because you're sick. So you will be ready to deal with people who are sad, who are crying, who are in pain. And so if that is okay for you, then nursing is for you. The setting, you will be working in the Philippines in the hospital setting, but now because of COVID, you can see that the patients are also found in the homes. What is it like? After 4 years, you graduate, you take the board exams. Your university will help you. Now, as soon as you take the board exams in the Philippines and then you pass it, I strongly encourage you to also make sure that you have filled out how to prepare and take the board exams for US, which is called NCLEX. It stands for National Council of State Boards of Nursing. So NCLEX is offered even in the Philippines, meaning you take it in a testing center, whether it is in a hotel, I forgot where, they will always tell you where to go. So NCLEX can be taken in the Philippines. So I strongly encourage you ladies that as soon as you take the boards for the Philippines, as soon as you pass it, then simultaneously, hopefully you would have already scheduled yourself for the board exams for NCLEX, which is the board exams for United States. In the US, what is the current state of the nation in America? We are in a state of crisis, state of emergency. We are experiencing severe deficit in the healthcare field. So we need foreign nurses. We need foreign Filipino nurses to come into America. The shift is now just like in the Philippines, hindi lang nakikita ang mga pasyente sa hospitals, but mostly in the homes or clinic settings. Because in America, we are encouraged to seek and go to our doctor even when we are not sick. It means it's a well care visit, meaning you're well. And it is good for the business, it's good for the economy, it's good for healthcare. Mas nakakatipid kasi hindi ka masyadong sick. And you prevent you from being sick, which is also good for you in the process. So where are nurses found? Hindi lang hospital, but you can see them in clinics. Well, where the patient will come in and to be seen for screening, for preventative health care. And it is good for nurses because nurses like it that they are in clinics as opposed to hospitals. It's less intense. You work regular hours. You go home at night. You don't have to suffer night duty. You have weekends off compared to hospital setting. Hospital setting, you will have to figure out what shift you like. Is it day shift? Is it evening shift? Or is it night shift? And you have to figure out, do you like to work 8 hours or 10 hours or 12 hours? So you have different kinds of options in the hospital setting, but then you will also realize you have to work sometimes during holidays or weekends. So you have a wide variety of options for nursing in the States. We can see that the hiring of foreign graduates, of foreign nurses in the Philippines or any other parts in the world into America will increase. We need nurses, and I know that U.S. immigration will open up more opportunities for nurses to come in United States because, again, we are in a healthcare deficit. We need nurses. The sign-in bonus is $20,000 right now, starting with annually $75,000 with $38 per hour pay. In other states where there is increased need of nurses, they'll ask you to do overtime for how many hours you can do, $300 per hour. So you will encounter words like CGFNS, which is a qualifying exam if you are ready to take the NCLEX exam. Please just check on the website if you still need to take CGFNS. It is an exam for foreign graduates like us. So I don't know anymore if we still need to take that or diretso na sa NCLEX because, again, the evolution of healthcare is rapidly increasing. It's a moving target. TOEFL is a test of English for foreign language. They will test you how you can pick and understand an American speaker. For someone like a patient who needs help, would you be able to understand that patient and would you be able to respond to that patient? So that's a test of English. It's a conversational languages. What are the different kinds of nursing? You will find yourself working as a hospital nurse, a clinic nurse, nurse educator, diabetic educator. Are you going to be a wound care nurse, an ICU nurse, a floor nurse, a rehab nurse like me, a traveler nurse where you can choose which states you want to work 3 months at a time? Would you like to be a nurse midwife, a home health nurse, a pediatric nurse, a nurse practitioner, a nurse anesthetist, or a nurse anesthesiologist? Would you like to be a school nurse, an office nurse, a hospice nurse? So there are different kinds of options. COVID. How does COVID impact nursing? Well, we predict that COVID, by the time you graduate, ladies, it will have turned into endemic, meaning the disease is now reduced to a particular area or region compared to pandemic where it's affecting globally, like all continents. We predict there will be more variant-specific vaccines to be developed. And because home is now the new office, healthcare visits will continue to be virtual video visits where you can see the patient through the screen without the patient coming to you in the clinic. So I encourage you to try nursing if you see that you are interested in human body parts, the anatomy, the physiology, how the human body works, and how you're able to help that human body be better. So the fulfillment is seeing someone get better. That's the fulfillment of nursing. And if you are okay with bodily fluids, if you are okay with dealing with patients who are not always going to be kind and friendly because they're in pain. So that's just understandable. Nursing is a teaching profession. It is a healing profession. So it's a beautiful vocation for the Lord. Now, because I am also master's in special education, I'm going to switch. So now I am Mrs. Verzosa as a special education teacher. Why do I have this funny hat? Because when you are a SPED teacher, which is special education teacher, you are ready to be enthusiastic, excited, energetic. You like to work with children or individuals with autism, different kinds of special needs condition. It can be cerebral palsy, Down syndrome, fetal alcohol syndrome, ADHD, or attention hyperactive disorder. You are going to be dealing with behavioral problems, those with emotional and depression problems. You will be working with parents. You'll be working with therapists, whether it's a speech therapist or occupational therapist. And where are you going to be found most? You will be found most in school or clinic therapies or even at home. You are going to bond with a child, and the gift is you're going to see that child grow through his growth and development. The fruit of this vocation is that you can see the spark in the eyes when a child begins to speak. A child who doesn't know how to speak because he has speech problems can begin to speak because of your concern and love and compassion. That is the fulfillment in being a special education teacher. And the advantage of a SPED teacher is that you can teach any student. What do I mean? A general education teacher teaches children without special needs, but a SPED teacher teaches children with special needs, meaning a SPED teacher can teach every kid, whether you have a child, whether that child has special needs or not. A SPED teacher can teach everyone, and so that to me is a plus. You can also think about whether would you like to work as a speech therapist or an occupational therapist. That is in the realm of special education. Speech therapist helps children who have speech defects and challenges. There you are. Occupational therapist, you're teaching them how to manage their everyday activities, the activities of daily living, how they take a shower, how they able to do personal hygiene and all that stuff. So that's occupational therapist, and also physical therapist. They go hand in hand in special education. So I am a registered nurse with Bachelor of Science in Nursing as a degree and Master's in Special Education. The similarity between nursing and special education is both of them are teaching and healing vocations. The difference is the setting. RNs are found everywhere, while special education teachers are found in schools, they're found in clinical therapies, and they're found in the home. But both are fulfilling, meaningful, and Christ-centered. And there's also a big need for special education teachers also in America, and I see it very fulfilling. I like it. It's not as intense as nursing, but it's also as fulfilling as nursing. So it is dependent upon the will of the Lord for you. And so I encourage you to ask the Lord to give you the Holy Spirit so that you can discern which vocation is right for you. Because remember, your career will be your vehicle towards Christ. So invite the Lord to your discernment, and the Lord will show you the way. I guarantee you. You can reach me at mtverz@yahoo.com, or you can message me on Messenger. Find me, Therese Zapanta-Verzosa. I am so honored and humbled that I am here to help you discern. And should you one day become a registered nurse or a SPED teacher, please send me a message. I would love to connect with you wherever you are, whether you're in the Philippines or in America. Shoot me an email and I am here to help you. So again, maraming salamat and God bless you all.